Welcome to Nursing Prep. Push yourself in nursing preparation with Smart Way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. All of the following statements are true about donning sterile gloves except Option A. The first glove should be picked up by grasping the inside of the cuff. Option B. The second glove should be picked up by inserting the gloved fingers under the cuff outside the glove. Option C. The gloves should be adjusted by sliding the gloved fingers under the sterile cuff and pulling the glove over the wrist. Option D. The inside of the glove is considered sterile. Right answer is Option D. The inside of the glove is considered sterile. The inside of the glove is always considered to be clean, but not sterile. When removing a contaminated gown, the nurse should be careful that the first thing she touches is the Option A. Waist tie and necktie at the back of the gown. Option B. Waist tie in front of the gown. Option C. Cuffs of the gown. Option D. Inside of the gown. Right answer is Option A. Waist tie and necktie at the back of the gown. The back of the gown is considered clean, the front is contaminated. So, after removing gloves and washing hands, the nurse should untie the back of the gown, slowly move backward away from the gown, holding the inside of the gown and keeping the edges off the floor, turn and fold the gown inside out, discard it in a contaminated linen container, then wash her hands again. Which of the following nursing interventions is considered the most effective form or universal precautions? Option A. Cap all used needles before removing them from their syringes. Option B. Discard all used uncapped needles and syringes in an impenetrable protective container. Option C. Wear gloves when administering IM injections. Option D. Follow enteric precautions. Right answer is Option B. Discard all used uncapped needles and syringes in an impenetrable protective container. According to the Centers for Disease Control, CDC, blood-to-blood contact occurs most commonly when a healthcare worker attempts to cap a used needle. Therefore, used needles should never be recapped. Instead, they should be inserted in a specially designed puncture-resistant, labeled container. Wearing gloves is not always necessary when administering an IM injection. Enteric precautions prevent the transfer of pathogens via feces. All of the following measures are recommended to prevent pressure ulcers except Option A. Massaging the reddened area with lotion. Option B. Using a water or air mattress. Option C. Adhering to a schedule for positioning and turning. Option D. Providing meticulous skin care. Right answer is Option A. Massaging the reddened area with lotion. Nurses and other healthcare professionals previously believed that massaging a reddened area with lotion would promote venous return and reduce edema to the area. However, research has shown that massage only increases the likelihood of cellular ischemia and necrosis to the area. Which of the following blood tests should be performed before a blood transfusion? Option A. Prothrombin and coagulation time. Option B. Blood typing and cross-matching. Option C. Bleeding and clotting time. Option D. Complete blood count, CBC, and electrolyte levels. Right answer is Option B. Blood typing and cross-matching. Before a blood transfusion is performed, the blood of the donor and recipient must be checked for compatibility. This is done by blood typing, a test that determines a person's blood type, and cross-matching, a procedure that determines the compatibility of the donor's and recipient's blood after the blood types has been matched. If the blood specimens are incompatible, hemolysis and antigen-antibody reactions will occur. The primary purpose of a platelet count is to evaluate the Option A. Potential for clot formation. Option B. Potential for bleeding. Option C. Presence of an antigen-antibody response. Option D. Presence of cardiac enzymes. Right answer is option A. Potential for clot formation. Platelets are disc-shaped cells that are essential for blood coagulation. A platelet count determines the number of thrombocytes in blood available for promoting hemostasis and assisting with blood coagulation after injury. It also is used to evaluate the patient's potential for bleeding. However, this is not its primary purpose. The normal count ranges from 1,50,000 to 3,50,000. 3. A count of 1,00,000 or less indicates a potential for bleeding. Count of less than 20,000 is associated with spontaneous bleeding. Which of the following white blood cell (WBC) counts clearly indicates leukocytosis? Option A. 4,500 per cubic millimeter. Option B. 7,000 per cubic millimeter. Option C. 10,000 per cubic millimeter. Option D. 25,000 per cubic millimeter. Right answer is option D. 25,000 per cubic millimeter. Leukocytosis is any transient increase in the number of white blood cells, leukocytes, in the blood. Normal WBC counts range from 5,000 to 1,00,000. Thus, a count of 25,000 indicates leukocytosis. After 5 days of diuretic therapy with 20 mg of furosemide, Lasix, daily, a patient begins to exhibit fatigue, muscle cramping and muscle weakness. These symptoms probably indicate that the patient is experiencing option A. Hypokalemia. Option B. Hyperkalemia. Option C. Anorexia. Option D. Dysphagia. Right answer is option A. Hypokalemia. Fatigue, muscle cramping, and muscle weaknesses are symptoms of hypokalemia, an inadequate potassium level, which is a potential side effect of diuretic therapy. The physician usually orders supplemental potassium to prevent hypokalemia in patients receiving diuretics. Anorexia is another symptom of hypokalemia. Dysphagia means difficulty swallowing. Which of the following statements about chest X-ray is false? Option A. No contradictions exist for this test. Option B. Before the procedure, the patient should remove all jewelry, metallic objects, and buttons above the waist. Option C. A signed consent is not required. Option D. Eating, drinking, and medications are allowed before this test. Right answer is option A. No contradictions exist for this test. Pregnancy or suspected pregnancy is the only contraindication for a chest X-ray. However, if a chest X-ray is necessary, the patient can wear a lead apron to protect the pelvic region from radiation. Jewelry, metallic objects, and buttons would interfere with the X-ray and thus should not be worn above the waist. A signed consent is not required because a chest X-ray is not an invasive examination. Eating, drinking and medications are allowed because the X-ray is of the chest, not the abdominal region. The most appropriate time for the nurse to obtain a sputum specimen for culture is option A. Early in the morning. Option B. After the patient eats a light breakfast. Option C. After aerosol therapy. Option D. After chest physiotherapy. Right answer is option A. Early in the morning. Obtaining a sputum specimen early in this morning ensures an adequate supply of bacteria for culturing and decreases the risk of contamination from food or medication. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.